In this video we going to review the top 5 deadliest and most dangerous snakes in the world. Number 1. Black Mamba. The black mamba is a species of extremely venomous snake that resides in sub-Saharan Africa. This snake is also known to live in both the ground as well as trees. As a result, they are often found along savannas, woodlands, forests, and rockier regions. It is in these regions that the black mamba often preys on birds and other small animals. Given its rapid speed, around 10 miles per hour, the snake is able to overcome most of its prey with ease. The mamba is known for its long length, at approximately 6.6 feet to 10 feet on average. Some black mambas have even reached lengths of nearly 14.8 feet, making it one of the longest venomous snakes in the world. The black mamba often maintains a color of gray, olive, and dark brown, with adults being far darker than younger mambas. Black mamba bite symptoms and treatment. Unlike other snakes, the black mamba typically delivers multiple bites when it strikes. Its venom, which is composed primarily of neurotoxins, induces symptoms within a span of 10 minutes and is fatal if antivenom is not administered rapidly. Rather than causing local swelling and necrosis, like many venomous snake bites, a black mamba's venom often causes severe tingling, a metallic taste in the mouth, drooping eyelids, neurological dysfunction, blurred vision, and paralysis of the respiratory system. Extreme drowsiness, inability to speak, nausea, vomiting, and extreme sweating are also common. Humans that are bitten by a black mamba will usually die within anywhere from 30 minutes to 3 hours after injection if medical treatment is not administered rapidly, but fatalities have been reported in as little as 20 minutes after injection. Unfortunately, antivenom is not widely available in many of the rural areas the black mamba calls home, where deaths caused by this highly venomous snake are still frequent. Number 2. Russell's Viper. Russell's viper, also known as the chain viper, is a venomous snake from the Viperidae family. It is found predominantly in Southeast Asia, China, Taiwan, and India. Chain vipers are quite common and are typically found in grasslands or brushy areas. They are also common around farms but tend to avoid forested regions, as well as marshes and swamps. One of the chain viper's primary food sources is rodents. As a result, these snakes are often found around human settlements, given the fact that rats and mice tend to stay close to humans. Chain vipers possess flat, triangular heads, with rounded, and raised, snouts. Their color patterns vary by snake, but they are typically yellow, tan, and brown in color. These deadly snakes can reach lengths of 5.5 feet, with a width of approximately 6 inches. Chain viper bite symptoms and treatment. Chain vipers produce a considerable amount of venom in their bites, which are highly lethal to humans in doses of 40 to 70 milligrams. Common symptoms from a chain viper bite include excessive bleeding, particularly in the gums and urine, a rapid drop in blood pressure and heart rate, blistering, necrosis, vomiting, facial swelling, kidney failure, and blood clotting. For individuals who seek emergency attention, antivenom is relatively effective against the chain viper. However, pain from the bite often continues for approximately 4 weeks and is known to cause severe tissue damage. Approximately 29% of survivors also suffer from damage to their pituitary glands. Number 3. Inland taipan. The taipan is a highly venomous snake that resides in Australasia. It is a member of the elapid family, which includes cobras, and is considered to be one of the deadliest snakes in the world today. There are 3 known species of the taipan, including the coastal taipan, inland taipan, and the Central Ranges taipan. Most of the taipan species are found along the northeast coast of Queensland, as well as the southern sector of Papua New Guinea. It primarily feeds on rats and bandicoots, along with other small mammals. Inland taipan bite symptoms and treatment. The taipan's venom contains high levels of neurotoxins. One bite from a taipan often results in paralysis of the victim's nervous system and clots the blood, preventing an adequate flow of blood through the blood vessels. Headache, nausea, vomiting, convulsions, paralysis, and myolysis are also common results of taipan bites, with respiratory paralysis setting in anywhere from 2 to 6 hours after the bite. Prior to the development of taipan-specific antivenom in 1956, only 2 individuals were reported to have survived the snake's bite. But the window of use for this antivenom is fairly small, so getting medical help immediately is critical, as with all venomous snake bites, of course. Number 4. Death adder. The death adder is a highly venomous elapid snake found in Australia, New Guinea, and the surrounding region. It is considered one of the deadliest snakes in the world, with approximately 7 different species making up its overall genus. Although the death adder has a viper-like appearance, it is actually a member of the elapid family of snakes, which includes cobras and black mambas. Death adders are quite short, with triangular heads and small scales adorning their bodies. They also possess large fangs, as well as a lure at the end of their tail that resembles a small worm. Typically, the death adder maintains a shade of black or gray. However, some death adder species can take on a reddish-yellow, brown, or greenish-gray hue. Death adder bite symptoms and treatment. The death adder's venom is a highly toxic neurotoxin. Bites from a death adder are extremely deadly and can result in death within 6 hours if treatment is not sought out. Similar to other snakes in this list, the venom often causes paralysis, as well as a complete respiratory system shutdown. Although antivenoms have been developed for the death adders, deaths still occur from their bite as antivenom is only able to slow down the progression of symptoms to a degree. Number 5. King cobra. The king cobra is the world's longest venomous snake, measuring up to 18 feet, 5.4 meters, according to the Natural History Museum, opens in Newtab, in London. The snake's impressive eyesight allows it to spot a moving person from nearly 330 feet, 100 meters, away, according to the Smithsonian Institution, opens in Newtab. When threatened, a king cobra will use special ribs and muscles in its neck to flare out its hood, or the skin around its head. These snakes can also lift their heads off the ground about a third of their body length, according to the San Diego Zoo, opens in Newtab. Its claim to fame is not so much the potency of its venom, but rather the amount injected into victims. Each bite delivers about 7 milliliters, about 0.24 fluid ounces, of venom, and the snake tends to attack with 3 or 4 bites in quick succession, the Fresno Zoo reported, opens in Newtab. Even a single bite can kill a human in 15 minutes and an adult elephant in just a few hours. Sean Carroll, molecular biologist at the University of Maryland, wrote in the New York Times, opens in Newtab.